Just give it a couple seconds. All right, we'll make sure we're connected. Probably. Okay. Well, if we're not connected, that's an issue. Oh, no, I think we are. I think we're good. Okay. Hi, everyone. We're going to do a healthcare symposium recap. That happened last week. It'll be about a 30-minute podcast if you want to join us. We're going to start that in just a minute while we wait for all these things to start up. And in the meantime, we will just be right back to take a quick break. So skip ahead about a minute if you're watching later. Hey, everybody. Welcome back to a bonus episode of Human Factors Cast. We are recording this live on April 21st, 2021. My name is Nick Roome, and I'm joined today by Elyse Hallett is over there. Hello, Elyse. How are you?
Oh, fantastic. How are you doing, Nick?
I'm great. We're back from a busy week at the Healthcare Symposium.
So busy.
Yeah. So we are here to break down kind of the Healthcare Symposium. It's a conference on human factors in healthcare. I don't know. Did you want to talk a little bit about it for anyone who couldn't join us for our preview episode?
Yeah, let's do it. So this year, I talked a little bit in the preview episode about how this conference is broken up into different tracks. So this conference, it's actually an international conference. So a lot of people from a lot of different parts of the world that are coming together to really talk about human factors in healthcare. The type of people that come, obviously include human factors professionals, but it's different flavors of human factors professionals, people working with medical devices, people who are actually embedded in a hospital. And then just beyond that, we're also talking about, sometimes doctors and nurses are coming. I've met physical therapists who come to this conference, just a lot of different people who are ultimately interested in healthcare, improving patient safety. And this just takes kind of a human factors flair, so to speak. So they break up this conference. It's been evolving. I've been going for a few years, and every time I come, there's, something new and something different, just to, show how they're really putting a lot of effort into tailoring this conference for the people who go. I think they do a really good job. But anyway, so they do different tracks. There's, I think, 5 different ones. They actually added a new one this year to, get at the like simulation and education aspect of supporting healthcare. And then, they tailor the talks based on those tracks. So if you're only interested in, say, medical devices, you're in industry building medical devices, then, they make it pretty easy for you to attend talks that deal with that. Or if you're a human factors specialist who's embedded in a hospital, which I find to be kind of an interesting role in and of itself, there's a track for that. So, they gear the talks based on the people who are coming. So, it's pretty easy to follow along and find sessions that you're interested in.
Yeah, so that new track that you mentioned, the simulation, that was kind of where I spend most of my time. And I think that was a kind of a good opportunity for me, someone who's never been to a healthcare symposium before and is attending one virtually for the first time this time. And full disclosure, I did get a complimentary pass to the event. We can talk a little bit about why or how that impacted my experience as well. But I want to take a one step back and kind of talk briefly about the structure of this event. This event is online, it's virtual, obviously due right now to the age of COVID, and we're just kind of getting out of the pandemic, kind of getting back into the swing of things. We're not quite ready to do conferences yet in person. And I'll go ahead and talk, and then maybe you can talk a little bit about your experience, Elyse. But from my perspective, this is very similar to the way that they did the Human Factors and Ergonomics Society annual meeting last year. They had this kind of virtual conference picture where you can click on different sections of like a virtual hotel lobby where you can go to different rooms and see different things. Like there was a poster session. There were, different rooms for every different type of track and event going on. And I think some of the things that really worked out well for me was the addition of some of the digital components that allow you to pick out your schedule and prioritize them and be able to navigate to them with just one click, right? Like HFES has had these apps in the past years where, you kind of build your schedule and then it will tell you what room to go to, but you still got to physically walk to that room. And I think removing that barrier of entry from putting it on your schedule to getting right into that content is something that was really done well. And like kudos, hats off to the team over there. I think it really worked well during the HFES annual meeting, and it worked well during the healthcare symposium. And I think largely they should probably try to keep that if they ever try to do a hybrid approach. But so from my perspective, as someone who's seen this, kind of knew what to expect, nothing much has changed, or at least I didn't perceive any changes from the virtual HFES event back in October of last year. And so for me, I kind of went into it knowing what to expect. But from someone with fresh eyes on a virtual event, Elyse, how was the experience for you?
I mean, it was really interesting. So, like Nick said, this was my first virtual conference. I've gone to this particular conference in person before, and so it was, fairly familiar with the setup of it. But logging in through a website was definitely a unique experience. But it was kind of cheesy, but I really liked the whole lobby setup when you first come to the homepage and how it's broken up. And, it really looks like a hotel lobby where some of these conferences would be set up. And I gotta say, one of my favorite touches that they did to really make this more personal is when you came into the lobby, in the morning when you're coming in, for the first time, there's a little video that pops up right away.
Yeah.
And, on day one, it was Joseph Keebler and Tony Andre, who, had put this together, who were, greeting me, telling me what to expect that day. Just the little touches that would kind of get organically if you were there in person. And, they really, I thought, made a good effort in still trying to bring, that personal touch to, the forum. The one thing, though, I will say was a little bit of a challenge was when logging into the sessions. Sometimes if I got in a little bit early, then the event had started, but sometimes I had to manually refresh my page. And, I didn't know that at first. So it'd be like a couple minutes into it. I'm like, man, what is happening? And then there'd be, a moderator sending on the chat, like, oh, you have to refresh your page. And, so there are a little bit of workarounds there. But I mean, once you figured it out, it, wasn't too bad. And it was pretty easy to navigate otherwise.
Yeah. One thing other structurally, and I didn't encounter this at all, and I'm curious if you did. At the annual meeting, I actually encountered scenarios in which the researchers had pre-recorded their presentations and basically played it on a video. So that way it's kind of exactly the information that they wanted to convey. They're not on a time limit, but they were still around to answer questions. I didn't see any of that this time around. Did you see any of that?
I think the only one that I saw that might have been like that, I think they tried to play it off like it was live. I'm not entirely sure, but I think it was because of time zone issues. But otherwise, everything was live, which I was actually very impressed with. That I didn't see more technical issues. There might have been like two that I can think of off the top of my head where I saw that. So given the amount of people who are doing this live, the amount of people who are logging in to see it live, like I thought that was very seamless in terms of that like live interaction.
Yeah, I agree that the live aspect is always interesting. That's why people tune in to us on Twitch and YouTube and Periscope when we're recording these episodes, because anything could go wrong at any minute. And that's why you go to NASCAR. You go for the crashes. You don't go for the race. And so,
Are you comparing this session with a NASCAR crash?
I'm comparing this podcast with a NASCAR crash. Let me put it that way. So the I would say if I could offer one criticism is that is what I would want to see more of, is those pre-recorded sessions, because then everything is taken into consideration ahead of time. Maybe you have that Zoom call where everyone is able to take questions from the audience at the end of their presentation or whatever, but that way everything is just so cut and tight. But this is also coming from somebody who produces content on a weekly basis, and so and I'm also being a little bit of a hypocrite here because we're recording this live, so I don't know.
How dare you?
I think people want different things when it comes to understanding and disseminating research. I want to almost just kind of take in the most perfect form of that. And if somebody has recorded something multiple times, they have picked the best edits of that and that's the thing that they want to present, right? That's just me. I don't know. But I was still very appreciative that everyone kind of was getting through some of these technical issues with the conference itself. Especially for having the challenge of having everything virtually. Anything else with the structure of the conference, Elyse, that you want to talk about?
Yeah, I mean, there was like kind of piggybacking off of your point about the pre-recorded. I think one of the rich elements of this conference is the discussion panels. Like you get these people who are out in the wild, right? And they start talking about, certain topics, and then in the chat you see people starting to make comments, and then it kind of starts to turn into much more of a rich dynamic conversation that is incorporating not only the expertise of the people who are on the panel, but then also the expertise of the people who are in, the forum and the crowd. So, I think if they were to have done this differently moving forward, where maybe there are elements that are pre-recorded, like you're saying, I think there should still be some balance though, where like some of the sessions are live to really produce those rich conversations, because I think that's why some people come to these conferences. And I think it still brings that very organic element to the conversation that otherwise we would very much miss with it being, totally virtual.
Yeah. And I might be getting a little cart before the horse here, but we're no longer going to have exclusively, or I would hope that, at this point, we're no longer going to have exclusively virtual conferences coming back out into the world after COVID's over. And so that chat aspect is something that I really do appreciate, because it does open up everybody to not only see names that are asking the questions, but it also allows you to have conversations while something is being presented. And what would be cool, and stick with me, but everyone's on their phone during somebody's presentation in a live setting, in a real hotel in person. And, you can chat out your question live without interrupting, and you can write it down so that way it's documented. And, you don't have to like stand in a line and awkwardly go, what's this? Oh shoot, I forgot my question. It's there right in the moment. And, people can, as they're watching, they can chat about it. I think that would be a super cool approach to like this hybrid thing, right? Where everyone has kind of the chat in their pockets and can just interact with it live.
Yeah, I love that idea. It kind of makes me think back to undergrad when some of the more techie professors would have, some of that integrated in their lecture, right? And so it even like gives some opportunity back to the lecturers. How many times have you been in a session and a lecturer like asks a question and nobody responds and it's just so awkward, but like that's a really seamless way to do it
Yeah.
in a room full of people where they might not always want to raise their hand, but sending a chat or something through some electronic forum would, definitely like help with that.
Yeah, I also noticed there was some interesting integrations going on, right? Like they were using Vimeo as the video provider, and then they were using Zoom for some of these networking events, and they think they used YouTube for the intro videos that they were pre-recorded. So there was a lot of different technologies going on here in this virtual conference, and I think it all came together really well. They all had their intended purpose. I would say that some of those technologies, like using Zoom, right? And this is again kind of a little bit of a criticism here. Some of the technologies like Zoom, I think there was one instance, and I'll talk about this a little later, where I really wanted to get into a Zoom call, but had another real world thing to attend to, and I couldn't make it. And so I tried to go and view it after the fact, and I couldn't find the recording anywhere. And I don't know if that's an artifact of, maybe it just wasn't recorded or something like that, or maybe Zoom doesn't allow it to interface with that, and I have to go look somewhere else. But that was a little clunky for me, and I didn't actually get to see that thing that I really wanted to see. Again, we'll talk about it in just a moment, but
yeah, but you bring up a good point. Like one of the things that I absolutely loved about this forum, I cannot stress how much I loved it, was being able to replay sessions. Because with me, conferences are such a flood of information that after like half a day, or by the time I get to Thursday, I'm just like so mentally tired from like hearing all this rich information. And there are talks and I'm like, oh, I know this would be so interesting, but I just don't have the mental capacity. And so being able to replay them and listen back to it, not have to worry about like capturing notes right away. I could just kind of absorb it. I really liked that option a lot.
yeah, it's really surprising to me that you're usually tapped out by like Wednesday or Thursday, because I'm tapped out before the Monday night, usually the gala even starts. So anyway, um, yeah, I agree. I think the playback is really useful, and I think especially useful. I think anyone who attends or is a member can go back and watch it at any time, or for a certain set period of time. It would be cool if all this was archived, right? Because then I can be like, I remember this presentation from HFES 2018 where they talked about the heuristics of VR and AR, and they did. And I would love to go back and rewatch that. It's something I think about quite often. So the
As we all do.
yeah. So let's talk about some of our coverage. So we obviously did the preview, and this was kind of what we were hoping to attend. This is kind of our agenda. If you tuned into that episode, it was Elyse and I breaking down sort of what we were hoping to see and get to during the course of it. We didn't quite get to everything for reasons that we'll talk about in just a moment, but we also have some fun, interesting interviews coming your way. So Elyse, you had a couple interviews. One of them is out now. Can you talk a little bit about your interview with Rebecca Butler?
Yes. So this was actually an opportunistic setup because I attended one of the panels that Rebecca was a part of. So Rebecca Butler is with MedStar Health, and she works as a human factors specialist that's really embedded in the quality and safety team, working with other types of specialties, supporting this network of hospitals. And, I know COVID was the big topic this past year. And so but when you go to a healthcare conference, and healthcare was, related to a global pandemic, it's kind of the,
Yeah.
big thing. But I think also too, I mean, just taking it from a human factors perspective, there's so many opportunities for, human factors to really shine, because of it's this systemic thing that's impacting so many different types of people, and how you do that and how you address that, I think raises a lot of really interesting questions. So Rebecca and her team, their panel had focused specifically on the communication strategy between the hospital and its staff. So in the beginning, if you can, dust off the cobwebs back to last March when everyone was like, oh, there's new information, it's constantly updating, well, that was happening with the hospital staff, and so how do you disseminate information about proper PPE guidance and how to test people when that information is changing rapidly, and we're not even talking about just considerations. Like, this is stuff that can really impact patient safety. And so, it was an interesting problem that they had set out to figure out of how do you, let's like strategize, let's do this smart to talk about, how we're going to communicate this information and make sure that they know they're getting the latest and greatest, and it's in a format that's usable and, easy to understand.
Yeah, that was a great one to listen to. Really excited for folks to hear that one. I'm also really excited for folks to hear the other interview that you happen to do. This one is not live yet as of the time of this recording, but you actually interviewed Martine Alfred.
Yep, that's correct. So,
Yeah.
Dr. Martine Alfred is with the Medical University of South Carolina, and actually I met her a couple conferences ago through a mutual contact of ours. And so every time these conferences pop up, it's an opportunity to keep in touch that way. So another benefit for folks listening of why these conferences are good. But anyway, so she had some interesting research that she was a part of, both related to COVID and then also beyond that. And I think she had such a fantastic perspective of the benefit that human factors can apply, specifically with respect to challenging topics such as equity, such as accessibility, really considering the diversity of our end users, even though it may pose some extra challenges, and how we go about doing that. So for example, it's super easy to set up a web portal to get people to sign up for vaccine appointments. This is just a very generic example to like hone in the point. But when thinking about the diverse population that an area has, not everyone might have access to, getting to that website. And so how do you support that? Okay, let's figure out a call-in instead, and that kind of support. So I thought that it was, a very good perspective because, human factors, it's so much more beyond just the products that we put forth or how we communicate with stakeholders. It's really that lens and that perspective that we can bring to some of these discussions, especially the ones that, impact larger systemic, problems that we're trying to sort out. So, in this case, that the hospital is trying to sort out. So I thought that was very interesting. And then she also touched on some of the research that she does, when not focused on COVID. Believe it or not, ladies and gentlemen, there is work outside of that. I know.
In healthcare, that's weird.
I know. No, but yeah, she's done some interesting work, and she's continuing to do interesting work. So I think that's going to be a fun one for people to listen to.
Yeah. So actually, that one will hopefully be hitting your ear holes soon. Then there's also another one that I actually just wrapped up literally an hour ago. So this one was
tell us about it.
Yeah, this one was with the student design competition winners. And it was a great conversation.
Wait, Nick.
Yes.
There's a student design competition? What is this?
Oh, yeah. That's where everybody gets together and they try to solve a problem in healthcare. And then there's a winner. That's what happens. I don't want to give away too much of the interview here, but what I'm going to say, it was very interesting. And they basically they talked about this. Let me. So it was Sophia, Divya, and Anna, and they were called Team Mothership of this design competition. And basically, what their app was trying to do was to solve the problem that working mothers had in the time of COVID, where they are exposed to task overload. There's a bunch of different tasks as them as the default caregiver have to do, right? Like, take care of the child and work. And so they were trying to solve this problem by not only interfacing with task management, but also with community building with other mothers. And lastly, kind of exposing them to research. And so you can hear more about their chat later on this week. Hopefully we'll get that out to you. If not this week, next week. We're just waiting on a couple things. But all those will be available. All those interviews will be available to you as part of our healthcare symposium coverage. I felt like all these interviews are really great.
Yeah, and they were pretty opportunistic in general. I think you and I got plugged in a little late in the game, and we were still able to come out with some pretty interesting talks.
Yeah.
And just a quick plug, this student design competition is something that this conference does every year. So if you are a student and you are interested in, finding ways to get involved in the professional community, this is one really awesome opportunity. They've been doing it for, ever since I was in grad school, not to date myself or anything, but, so they do it every year, and it's always seems like a lot of fun.
Yeah, it sounded like a ton of fun. So with that, there's let's talk about what we actually were able to get to. Full disclosure, like I said at the top, I got a comp pass, and this is because planning for a conference is when you go to a conference physically, it's often your main focus is to go to the conference and network with people, catch up with old friends, go to things that you're interested in. When it's virtual, at least for me, and especially since I got this so late breaking, I think we talked about it literally the Friday before it happened. And it was one of those things where I struggled with attending sessions, balancing real world work and family obligations, as well as a podcast to push out, right? So like all these things together prohibited me from attending as many as I wanted to. I still got to a couple of them. But again, part of the beauty of this symposium is that everything is recorded and I can go back later and watch it. And that's really nice. So, I'll talk about a couple things, but Elyse, let's just talk about it from this perspective. What were some of the favorite things that you were able to go to?
So I'm sure other people probably experienced this too. I experienced a similar challenge that you did, and I would imagine that even if people had a heads up, and were able to plan around, work and such, they would probably still run into this issue of trying to balance things. But all that being said, I was able to catch the opening talk with John Nance, who really talked about this concept of what is good enough? How are we defining good enough? So with that, I'll actually dive into that one just a little bit. And I have my notes over.
Yeah, I was there too, so we can bounce off of each other on this one.
Perfect. So he comes from an aviation background, and I always get really interested when people come from one domain and then kind of apply metaphors across domains. So he had this one story that I really enjoyed, where he was the co-pilot on a plane, and there was this LOL, which he defined as little old lady. not laugh out loud, but a little old lady, which is actually, I think, a technical acronym he was saying that they have.
This is the turnaround story.
Is the turnaround story. And she was saying that, so he gets this, notification up in the cockpit. There's this, LOL who wants to talk to, one of the pilots. And, so him being the co-pilot, he's like, okay, I'll go back there. And, so he makes his way, and, it's the very back of the plane. And she's like, oh, there looks to be like there's some fluid coming off the plane. And, he had, been formulating in his mind, like all the reasons why they're like, oh, maybe it's precipitation and what. And he looks out the window, and sure enough, there is like gallons of fuel that is escaping from one of the wings. And so he's like, "Oh, that's interesting." Rushes up to the front, like talks to the other pilot, turns it around. And it ended up being a near miss, and they were able to get everyone safely to the ground. But it is just one of those stories about how he was primed, because just like a week or two before that, he said that they had gotten a notification from the airline about, oh, you should really pay attention to what everyone around you is saying, and that includes passengers on the plane. So do not dismiss what people are saying, because they might have a perspective that you don't always see right away. And so he had read this, was like, oh, okay, great. And then this happens, and they're able to save everyone, because he had listened to that and didn't dismiss the passenger. And so he was talking a lot about communication is so critical with all this. And if we assume we are 100% error free, we are perfect, which is essentially the perspective that I think a lot of physicians and surgeons are trained with. They have to, be performing at this high level because the patient is in their hands. But that has its own kind of follow-on implications as a result of it. So, yeah, what did you think of the talk, Nick?
I thought it was a great talk. Lots of fun, entertaining clips from pop culture that really kind of hammered home his point of communication. And back to the aviation story, it wasn't just the communication between the LOL and the co-pilot. It was also the communication between the co-pilot and the pilot. The pilot didn't want to listen to him. He's like, "What's going on?" And he just said, "If you trust me, just turn around right now. I'll explain in a minute." And, it's like, the trust between teammates needs to be there too. I think that talk largely was important because, like you said, we're talking about basically how we're not perfect. And I think the lesson of that story or that talk is that we can't necessarily fault ourselves for being error prone in certain situations, but we do need to change how we think about adopting some of these newer tools, and adopt how we approach some of these processes for the betterment of patients. Right? I think there was a story that he was telling about some doctor that didn't want to adopt a technology because it was the way it's always been done, and he was talking about how dangerous that way of thinking is when it comes to patient health, because someone looks up a procedure and understands that it's more effective than maybe something else, and if they're not getting it from this doctor because the doctor doesn't want to learn it, then they're not getting the optimal care that they deserve. So I thought overall is just an incredibly powerful story and talk, and I'm really glad that I was able to attend that one for sure.
Yeah, it was a really good one. He had one quote in there. It was something along the lines of, any human system built on the expectation of perfect human performance has built itself to fail. And I thought it was so good because, he was trying to hone in on the fact that, a lot of times in healthcare, people are trained to be 100% of the time. And so you talk about these long shifts, you talk about like all this complicated technology that's constantly being introduced into the hospital. And then you're like training people, they have to be 100% all the time. It's just, and then he made this other great point where, it's important to believe that we can get to zero in terms of error rates, and how he had overheard, when this concept was first coming out in aviation and they were bringing in crew resource management, and, this concept of decreasing error rates was really starting to become a forefront. He had overheard someone say, like, we can't possibly get to zero. Like, that's impossible. We're going to make mistakes. And he's like, yeah, that's true. But if we don't believe that we can get to that, we will never come close. It's that bar that we're setting. And so overall, I thought this was a great like starting talk to the conference. It was like the exact kind of inspiration that I think a lot of people who are working in healthcare probably needed to, reinvigorate that motivation of not motivation, but inspiration of pushing the bounds and really getting past the curmudgeon personalities that sometimes might pop up there.
Yeah, for sure. So I want to be respectful of our time here. So I'm going to ask you rapid fire. Give me like the top 3 things that you attended that and some fun takeaways. Ready? Go.
Oh gosh. Okay. So there was one, it was an opening session with medical devices, and it was talking about this concept of does human factors actually save lives? And it was interesting because it's hard to measure a problem if we're preventing things. So it was an interesting way of thinking about like ROI and how human factors is really making an impact, and how to try to measure that. And so that was an interesting one. Topics about COVID were interesting for me, especially when talking to people who are embedded in the hospital. One of my favorites in that actually is, I guess, when COVID first started, HFES, I think it was HFES, put out a talk about like COVID specifically and how you can get involved as a human factors person. And that actually inspired quite a few professionals embedded in these hospitals to go reach out to their bosses and say, hey, like, this is what I can do. How can we get involved? And that actually started projects. And it was because of, this outreach event that, HFES had put forth. And so they were like, we want to see more stuff like that because, that was really motivating. So I thought that was a really cool, like, full circle moment where it actually inspired people to reach out and then from that get involved in projects. And back to you, Nick, rapid fire. What were some of your favorites?
So some of my favorites here, education and simulation keynote, they also talked about aviation, and they were talking about kind of what can we apply from other domains to healthcare. They also talked about usability of medical devices and equipment, and sort of implementing some of these guidelines and protocols for equipment as well. So that education simulation keynote was pretty interesting. I would say there was another talk about cognitive assessment games saving us from cognitive decline. So, we're kind of preserving the problem space is that we're preserving our bodies for longer, but we're not necessarily preserving our minds for longer, with, dementia, and other, aging effects. So they were looking at like mobile applications, allowing measurements to be taken worldwide. So it has this big scale, large scope, and allows you to standardize across multiple countries. So you can kind of get some of that information. Last one that I'll kind of briefly mention here is that chatbots and gamification. There was a really interesting chat talk about chatbots and gamification and kind of what is a chatbot, and how healthcare is impacted by this, right? Because if you talk to a chatbot, there's all these different considerations that you have to make. Like there's somebody who's behind the scenes designing a conversation, almost like a theater director. They have to map out these conversations, like what are some potential things they might say here. And then, it's also, there's the ethics behind it. Like what happens if a person thinks they're actually talking to a human instead of a chatbot? So that was also a very interesting chat. Without getting too into them and too spoilery, I'd highly recommend anyone who was able to attend, go listen to those. If not, find a way to, get in touch with those researchers because they were some pretty interesting things. With that, Elyse, any other closing thoughts on the healthcare symposium for 2021?
Not anything big. I'm just really thankful that I was able to attend and have it be in a virtual environment. It was a little tricky juggling it with, work at the same time, but honestly, I'm most excited to like recap on the sessions that I missed and like continue watching some of them and learning. And for folks who are interested, they are actually doing it in person next year, I think in New Orleans. So that's the plan, and it sounds like it should be a lot of fun.
We'll see you in New Orleans, right? All right. For me, I think the one key takeaway I have with this is if you're going to a conference, give it your full undivided attention. Like go out to a hotel locally or something and just attend the things that you want to attend. It's kind of weird with the virtual format. I am thankful for it. I just think that if you try to do it all, you won't be able to do much of any of it. So take what you will from that. But that's going to be it for today, everyone. Let us know what you guys think of the coverage of the Healthcare Symposium. If you want to, you can hang out with us in our Slack or Discord or get to us at any of our social channels. You can visit our official website and sign up for our newsletter to stay up to date with all the latest human factors news. If you like what you hear, you want to support the show, there's a couple ways you can do that. One, leave us a 5-star review on your podcatcher of choice. If they don't have one, you can leave it on our website. 2, tell your friends about us. That's how we help the show grow. And 3, if you're able to, consider supporting us on Patreon. That really helps us too. And as always, links to all the stuff that we talked about, the Healthcare Symposium, all of our interviews will be in the links in the description below. I want to thank Elyse Hallett for being on the show today and breaking down this Healthcare Symposium with me. Where can our listeners go and find you if they want to talk about the Healthcare Symposium?
Yeah, you can find me on LinkedIn. It's probably the best way. Thank you so much for letting me be on the show, Nick. This has been so much fun.
Well, thank you for joining me, Elyse. I really appreciate it. And I always like when we get to chat about human factors together. As for me, I've been your host, Nick Roome. You can find me streaming on Twitch Tuesdays at 11 a.m. for office hours and across social media at Nick_Roome. Thanks again for tuning into Human Factors Cast. Until next time, it depends.
It depends.